Sister Berak Hussain. To begin, please join me in reciting a short surah, Surah Al-Kawthar from the Holy Quran. Bismillahirrahmanirrahim. Inna a'tainaka al-kawthar fasalli lirabbika wanhar inna shani'aka huwal abtar. Allahumma salli ala Muhammad wa ali Muhammad. Mental health. Yes, I said those two words. Mental health. These two words hold so much importance in how we live our lives and how we interact with one another, yet often they are considered taboo in many of our cultures. Alhamdulillah, in the past years, mental health has gotten a lot of awareness, and that's wonderful, but that's not enough. As individuals, there's a lot more to learn. As community, we can do better. As a community, we need to do better. So to get started in our mental health journey and understanding what mental health is, we have Sister Berak Hussain, a registered psychotherapist in Ottawa, who will discuss her profession and mental health issues. Sister Berak Hussain has a BA in psychology and a master's in educational counseling from the University of Ottawa. Currently, she's an international student counselor at Carleton University from the University of Ottawa.
Sister, sorry to interrupt. If you have any window open for live streaming, can you turn off that? Your voice is getting feedback from your mic. Or all others, if you can mute your mic.
Thank you. All right. So currently, she's an international student counselor at Carleton University, and in social media, she's known as the Muslim counselor. She has worked locally and internationally on a variety of mental health initiatives with great determination to break the stigma around this topic. She's an advocate of mental health and believes in helping her clients to heal through the stigma around this topic. She's an advocate of she addresses multiple Islamic and psychological issues, as well as providing Islamic counseling to local practitioners in the hopes of bridging the connection and misconception around Islam and mental health. So before I pass on the mic to Sister Berak, I did want to mention that, inshallah, at the end of the session, we will have time for questions. So if you did want to submit any questions, please do so. There was a Google form link that was sent, that was indicated in the email, and I believe there's a WhatsApp message that was circulated around, which also has that link, which you can submit your questions. So without further ado, let's get started. Assalamu alaikum, Sister Berak. How are you today? Oh, I think you're on mute. Okay, take your time.
There, can you hear me now?
Yeah, I can. Thanks.
All right. Assalamu alaikum. I'm doing well, thank you. How are you doing?
Alhamdulillah, I'm doing really good. I'm super excited for your seminar. I think we've been waiting like a really long time to have like a mental health seminar. So thank you so much for joining us. It's an honor to have you. So I'm gonna stop talking and give you the stage. So good luck and go for it.
Thank you so much. Assalamu alaikum, my brothers and sisters in Waterloo, Kitchener, and area, and for all of those who are joining through social media, watching our program today. A big salamu alaikum to you, and welcome to this program. First of three, inshallah, today we are going to be discussing mental health in terms of how it is something that is important to us, right? In terms of the mind, body, heart, and soul. And today specifically, we're going to be taking a look at understanding what mental health is, especially in the Muslim community. Always like to start with the salawat ala Muhammad wa ali Muhammad, of course, and the peace and blessings be upon our holy prophet Muhammad and his holy progeny. When we begin talking about this topic of mental health, I always like to begin discussing it with this beautiful verse from the Holy Quran, Surah Al-Ra'd, Thunder, which expresses guidance from Allah subhanahu wa ta'ala in attaining that inner peace and that serenity through remembrance. So, Bismillah ar-Rahman ar-Rahim, Ala bi dhikrillah tatma'inna al-qulub. And so this remembrance and reflection from the Quran and the Ahl al-Bayt helps us to encompass all aspects of our lives, right? Including the pursuit of knowledge, happiness, and especially from the Ahl al-Bayt alayhim salam. And inshallah, through our 3-part series, we get the opportunity to do that type of reflection and seeking this knowledge through understanding what mental health is all about. The second part, inshallah, will be looking at Islamic concepts and Islamic counseling and how we can apply that in everyday life. And this was based on my graduate studies research, and also something that we're implementing now in the Marja'iyya at a North American level, inshallah. And finally, our third part will be taking a look at how to take care of our stress. So we'll be doing some stressful or stress mindfulness release, inshallah. So for today's session, we'll begin by taking a look at understanding what mental health is, what is well-being. We'll be taking a look at some Canadian statistics. Then we'll look at misconceptions, barriers, and common illnesses. And it's not just going to be me speaking. For those who are interacting on YouTube, I'm going to have YouTube open here next to me so I could see if anybody has questions, and the moderators, they can pop in the questions and answers, because I'll be asking questions, and it'd be great for people to participate, even the moderators, if they could jump in and answer some questions. They'll be interactive, not just me speaking. Usually we do this in person, this type of workshop and presentation, and because of the pandemic right now, we're doing it virtually, but we can still interact, absolutely. Next, we'll take a look at what counseling is all about. We'll look at gender variances as well. And we'll take a look at signs of depression, anxiety, and finally looking at supports and resources. In our final part 3, we'll be doing a mindfulness meditation, inshallah, through breathing techniques and progressive relaxation of our body to help us understand how we can combine everything that we've learned in part 1, 2, and 3 at the end of that, inshallah. So something to look forward to. So let's begin with a Bismillah and a salawat ala Muhammad wa ali Muhammad. Allahumma salli ala Muhammad wa ali Muhammad. So before we even begin even further, when I was first studying psychology in university and coming from the Iraqi community, people ask me, what are you studying? And I'd say psychology. And I'll translate, they said, so you're going to be just as crazy as those people that you will be treating. And, we find this funny, so to speak, as a joke, but in reality, the statistics show that it's not funny when we have 1 in 5 people, especially here in Canada, struggling, suffering from mental health disorders or challenges, or even, let's say, know somebody who they will experience it themselves. So it's the statistics are pretty high when it comes to that reality. And that's why it's really important to understand and get in depth and understanding the meaning as well of what is mental health. Because as soon as we hear the word mental health, what comes to mind is what I hear from people. They tend to believe that it's about being crazy, right? There's something wrong with you, that you're unstable. And essentially, if we look at the definition here, it just means, by the Canadian Mental Health Association, that mental health means striking a balance amongst all aspects of your lives: social, physical, spiritual, economic, and mental. And we go on with this other definition from the World Health Organization. It's just defined as a state of well-being in which every individual realizes his or her own potential. They can cope with the normal stresses of life, can work productively and fruitfully, and to be able to make a contribution to his or her community. So it's a really lovely definition where it encompasses all aspects of our life. We can connect with this. It's not a scary definition as we once thought it was. And like we said, there is this misconceptions, and we'll get into a few details of those a bit later on. But you see that it's a definition that makes sense. It's not something scary or frightening, yet we still have those misconceptions and fears. So let's take a look at some statistics here, or rather a little bit more in depth in terms of what it is, right? So we look at, in terms of well-being, it's maintaining an optimal level of wellness, which is absolutely crucial to have a higher quality in life, right? And it matters. Why does wellness matter in our life? Because everything we do, And every emotion that we feel relates to our overall well-being. So in turn, our well-being directly affects our actions and our emotions. And it's an ongoing circle, right? So it is important for everyone to achieve that optimal wellness in order to reduce our stress and reduce the risk of illness and ensure that positive interaction, right? And if we take a look at, is one of my favorite aspects of discussing wellness, because it directly is connected to our Islamic faith. When we take a look at the 8 dimensions of wellness from the University of California, the Davis campus, their student health counseling services really describe well here the 8 dimensions of wellness that we have. So you got your occupational, you got your emotional, spiritual, environmental, financial, physical, social, and intellectual. And you see here that each of these dimensions is equally vital in the pursuit of that optimum health. And one can reach an optimal level of that wellness by understanding how to maintain and optimize each of these dimensions. Now, if we connect this to an Islamic perspective, and I find, and we compare it to the hadith by Imam Musa al-Kadhim alayhi salam, in which he says, to divide your time into 4 parts, right? An hour to Allah subhanahu wa ta'ala, an hour to work to provide for your family, an hour to socialize with friends and those who are trustworthy and can keep your secrets, of course, and last, an hour for yourself in which you can perform what you desire without falling into haram. So it doesn't mean that you divide your parts exactly into those equal 4 parts in the literal sense. However, it is that advice to divide our time in a good balance. And so if we look at this, all dimensions of these 8 parts of wellness are encompassed in the 4 that is described by Imam Musa al-Kadhim alayhi salam. So you see right there, wellness is something, and balance to reach our optimal full self is also something that is from our religion. It's something that is encouraged as well, to have that healthy balance. Let's go a little bit further now and look at numbers. And this is something we've mentioned already here, where 1 in 5 people in Canada will personally experience a mental health problem or illness, or will know somebody. That's 1 in 5. So imagine your circle around you of 1 in 5 people. That's a pretty high number if you think about it, right? We see that it affects people of all ages, all education, income levels, and cultures. We see approximately that 8% of adults will experience major depression at some point in their lives. It's estimated that 10 to 20% of Canadian youth are affected by mental illness or disorder, and the single most disabling group of disorders worldwide. Now imagine these stats were pre-pandemic. Imagine during pandemic and right now what the statistics are. They're much higher now when it comes to dealing with depression and isolation and anxiety because of the pandemic that we are in right now. So approximately 5% of male youth and 12% of female youth also experience a major depressive episode. So ages 12 to 19. Keep this in mind when we talk about gender variances, all right? The statistics here, keep that for later as well. So I'm going to be prompting for you to keep certain things in mind that we'll connect with later, because it's boring if it's just me talking, right? We've got to have a little fun and get this to be a little bit more interactive. So we take a look at more statistics here. Suicide is amongst the leading cause of death from 12 to 24-year-olds Canadians, only second to accidents, where 4,000 people die prematurely each year by suicide. I forgot to mention right at the beginning that we will be talking about sensitive topics that could be triggering. If that is the case, please do reach out to your local mental health practitioner, whether it's your medical doctor or a therapist, if you find yourself impacted or triggered by some of the topics we'll be discussing. At the end of our discussion today, I will be providing some resources as well that you can access, as well as free counseling, inshallah. So when we take a look at the mortality rate due to suicide among men, it is 4 times the rate of amongst women. And I was reading in a book yesterday, the book of the rights of women in Islam, and even then it talks about, when we talk about gender variances, they even noted that Sayyid Murtada Mutahari, he himself noted that when it comes to men's behavior, they tend to be more aggressive when looking at suicide. They will tend to use more violent means, as women will use more softer means, right? So it's interesting that even from Islamic perspective, we take a look at how that's why you have the higher rate of men succeeding, so to speak, and that's the term we use in psychology, completing a suicide, because of how violent and aggressive they would use methods to end their lives. Okay. I know it's kind of gruesome and morbid to talk about it, and I probably speak about it as though I'm, talking about the weather, and it's because this is my daily work, in and out. I probably have 4 or 5 sometimes suicidal patients a day, and so we work through. It's not because I'm desensitized, but because I'm so used to speaking about it, it comes out as, oh wow, she's just speaking about it like she's having a croissant, when in reality, this is the lingo and the language and what we're used to, right? And I know for some communities, this is like, whoa, this is something I haven't heard of. This is something I'm not used to. And so it can be a little bit shocking and new when you hear these types of statistics, right? If we go a little bit further here, when it comes to disability and early death, you see the numbers are really high here in terms of the money, in terms of how much is spent on care, right? And we look here, 6.3 billion was spent on uninsured mental health services and people off work for depression and distress, but weren't really treated by the healthcare system. I know we have a different type of awareness now, especially in the pandemic, when there's been a spike of numbers when it comes to mental health statistics. So these obviously are changed now than they were before. So let's take a closer look now that we have an understanding of what the definition is. We've compared it to Islam a few times now. We're getting a little more comfortable now. For those of you who are watching, inshallah, you become ambassadors of talking about mental health in our communities, being able to reach out to people, recognizing the signs of people who are perhaps experiencing these challenges, and getting them to get the support that they need, inshallah, as we go along. So it's really important to take a look at understanding what these misconceptions are, and looking at what are some of the main barriers and what are some of the most common illnesses that we have within the Muslim community. So let's jump right in, and this is where I'm going to need both our moderator as well as our audience members, and I'll make sure to watch for that as well, but I need the moderators to help me with this as well as we get into the next slides, because I'm not going to be talking the whole time through here. So let's see here. So let's take a look at some of these misconceptions, and they're so easy to kind of label a certain way, but it's so important to get into the details of these, right? So in terms of the misconceptions, it's all about the stigma, the fear, and discrimination. People feel that you might catch in a mental illness, right? So the reality is that it affects everybody, like we said earlier, right? We are all likely to know somebody who has experienced these types of illnesses at some point, yet there's still so many hurtful attitudes around mental illness, right? And that fuels that stigma and discrimination, makes it harder for people to reach out and get the support that they need. So let's take a look at some of these myths about mental health, true or false, and let's dig it right in. So number one, this is where I need your, inshallah, we'll need your answers. I just saw a question that said, Assalamu alaikum, do we have data from within our Muslim population? Is it even higher? Now, because mental health in the Muslim community has been fairly new, we could say within only the last 5 years, and I say this from when we first started propagating and promoting and talking and pushing about mental health within our community, there hasn't been really much research done as, let's say, in the general population. Within the last few years, especially in the Shia community, I know our brothers and the Sunni sisters and brothers in the Sunni community, they're a little bit more far ahead with the mental health because they've got journals and conferences and workshops, and even practitioners who are working in the field, including doing research. The numbers are similar, right? But then there are different, and we'll get into it further later on. We'll jump to answer that later on. The numbers are similar. However, let's say some of the issues are a little bit different, right? When it comes to anxiety and depression, when you break them down even more, they're more related to things that are connected to Muslims and issues that people of ethnic diversity backgrounds will be impacted with than the general population. So we'll jump into that in a bit later, and that's a great question. So now I'm going to ask the audience, and I'd like your participation, please. So number one, mental illnesses. They are not real illnesses. True or false? What do you say, Sister Tuba?
False.
They're false, yeah? And the audience too. I'm waiting to see participation there as well. But while the sister answered, that's true, because we see that the words we use to describe mental illnesses, that's also changed over time as well, right? What hasn't changed is the fact that mental illnesses are not our regular ups and downs of life. Mental illnesses, they create distress, right? They don't go away on their own. And they are real health problems with effective treatments, alhamdulillah. So for example, when somebody breaks, and I always use this example, and this is when we really connect, when we break an arm or a leg, right? We wouldn't expect somebody to just get over it, right? We would even we wouldn't even blame them if they needed a cast, right? Or if they needed a sling or other help in their daily life, right? While they recovered. But why is it that if somebody has a mental break or a break in their mind or a breakdown, and we hear about them in the hospital, we don't have the same compassion? We judge, right? There's fear, there's talk, there's gossip. Like we wouldn't actually go and support that person, like go take some food over to their house or anything like that. If somebody broke an arm, we'll go in and help clean the house, do their laundry, right? But we wouldn't think to do that with somebody who is dealing with mental illness. So it's really important to understand that physical illnesses and mental illnesses are very similar. If we take a look at people who need to take an insulin shot because they got diabetes, we wouldn't judge them for taking the medication, right? The insulin. We don't judge them for that. They have to change their lifestyle and so on and so forth. There's no judgment there. However, again, when there is the need to take medication for mental illnesses, there's that fear of becoming addicted to them, or is it going to be a lifetime? Well, then what about diabetes then, or cardiovascular disease? Do you not need medication to manage that, right? So it's the same concept. If we can bring our mind to the same idea of mentality here, then we soften up in terms of shame and judgment and so on and so forth. All right. Thank you so much. I see a lot of people have also answered, but I'm hearing my voice back. I'm not sure. Maybe Sister Tuba, you need to mute perhaps the feedback. All right. I don't mind it, but just in case it disrupts the audience. Okay, number 2, if we take a look at mental illnesses will never affect me. True or false?
I think there's a few seconds delay, so
That's
if you
okay.
wanted to give an audience.
I'm just waiting. Yeah. And by the way, did you guys share the YouTube link on our Facebook event page? If you share it there, then people can also access it as well. Just want to put that out there.
Oh, awesome. Good to know.
Yeah, if you can just put the link in, or even on your Zahra page, then I can also share it on my pages.
Oh, brilliant. Okay.
All right, so I'll just wait for people to answer the next question. There we go. There we go. So lots of great answers here. All right, so people are saying false, that it affects all of us. Absolutely. When we take a look at mental health in terms of how it affects all of us will be affected by some kind of mental illness or disorder or challenge, right? And researchers estimate that as many as, like we said, 1 in 5 people will experience this kind of mental challenge at some point in their life, or know somebody, right? You may not experience it yourself, but you could know somebody who, a family member or friend or colleague, and so on and so forth. Absolutely. And also don't forget, as Muslims, we're like, oh, we have faith in God. We read Quran, we're not going to be affected. But I mean, do you not get affected by a cold? Do you not get affected by, right now, the pandemic that we're living in? Any of us caught the virus itself, diabetes, you're not immune to that unless, you're deliberately having, donuts all day long. And then that lifestyle can definitely create and wreak havoc to that, right? But you see here that it can impact anybody of any background. Okay. Sorry, I'm just, there's a bit of an emergency. If you just give me one moment.
No problem. Take your time.
Just one moment, just 1 second, please.
No problem. Awesome. Everyone, thank you so much for participating. We really do appreciate it. Once again, if you do have any questions.
I'm sorry, I'm in the program. Is everything okay?
Is Mom with you?
No, she went home. Why?
Sorry. So yeah, if you do have any questions or anything like that, please do submit them in the Google form link. And please do keep interacting. It makes it more, I mean, it's great learning when it's more interactive. So, oh, we have Sister back.
There we go. All right. So yeah, no, mashallah, everybody's being really proactive in responding. So number 3, so mental illnesses are just an excuse for poor behavior. True or false? What do you think that is? So just waiting for people to pop in their answers.
Would it depend on the excuse? I feel so bad for saying this, but would it depend on the excuse itself?
Well, that's a good way of putting it. Yeah, yeah. So a lot of people are saying false, false, false. So it's interesting to see that it is true that some people who experience mental illnesses may act in ways that are unexpected or seem strange to others. We just need to remember that it is the illness, right? Not the person who's behind those behaviors. So nobody chooses to experience a mental illness, right? And so people who experience a change in their behavior due to the mental illness may feel extremely embarrassed or ashamed around others. So it's also true that people with a history of mental illnesses are just like anybody else, right? They may make poor choices, like you were saying, sister, or do something unexpected for reasons unrelated to the symptoms. Okay, so that's something to keep in mind there. Great. So number 4, bad parenting causes mental illness. True or false? So I see some people are saying true, some are saying false.
Wouldn't it like depend though? Like, oh, I don't know. That's a very good question.
Yeah. So this one's a bit tricky, right? Not sure if it causes the illness. Somebody's saying could be false, true. Yeah. So this one's interesting because it's not one particular factor. So not one factor can cause the illnesses because they are complicated conditions that arise from a combination of genetics, biology, the environment, life experiences, right? So family members and loved ones, absolutely, they do have a big role in the support and the recovery. Now, if we're talking about childhood abuse from parents, absolutely there's a link to depression and anxiety, ADHD, and other challenges and conditions and illnesses. So when we're connecting it that way, then absolutely. But bad parenting, we can say, doesn't necessarily cause it, but it's one of many factors that can contribute to that. So that one could have seemed to be almost like a trick question in a way, right? So number 5, people with mental illnesses are violent and dangerous. True or false? I'll just wait for the answers to pop in. Some people are saying it depends, false, some can be violent. And that's the thing, right? Is that some people in research, we try to predict violence so they know what to avoid. However, the causes of violence are complicated. So researchers agree that mental illnesses are not a good predictor of, it's not a good predictor of violence. However, when we take a look at mental illnesses on their own, people who experience these illnesses are no more violent than people without mental illnesses. Excluding people from communities, however, that is linked to violence, right? And people with mental illnesses are often amongst those who are excluded. So it's also important to note that people who experience mental illnesses are much more likely to be victims of violence than to be violent themselves. And I see that some people are saying, you know, some may use aggressive behavior or language, but it's not the norm. Yes, some can be violent, especially if not taking medication. Absolutely, right? And false. If it does not happen, then that means that the illness has not been addressed when it should have been. So these are interesting feedback, what people are sharing. Thank you so much. I'm loving the participation here. It's wonderful. Number 6, people don't recover from mental illnesses. We'll just wait for people to plug in their answers. All right. So people are saying false. No, people do recover unless the patient chooses not to acknowledge and treat it. Absolutely. Great answers. So people can and they do recover from mental illnesses. We see today there's many different kinds of treatment services and supports that can help, and no one should expect to feel unwell forever. The fact is, people who experience these illnesses, they can and do lead productive and engaged lives, alhamdulillah. You know, they work, they volunteer, or contribute their unique abilities and skills to their communities. So even when people experience mental illnesses that last for a long time, they learn how to manage their symptoms so they can get back to their goals, right? So if somebody continues to experience challenges, like it was brought up from one of our audience members, it may be a sign that needs to be a different approach of support to helping manage that. Great, thank you so much. So number 7, people who experience mental illnesses are weak and can't handle stress. True or false? So just wait for people to pop in the answers. So true, false, they are humans. We all get the cold, absolutely. So the idea here is that when it comes to stress, you know, it impacts our well-being, like we were saying earlier, and this is true for everybody. So people who experience mental illnesses may actually be better at managing stress than people who have not experienced mental illnesses. So many people who experience them learn skills like stress management, problem solving, and they take care of their stress before it affects their well-being. So taking care of yourself and asking for help and support when it's needed, these are signs of great strength, not weaknesses, right? And what we have in our communities is the opposite, is that, oh, you should keep it quiet to yourself. You should not ask for support because then it's considered weakness. You should only be asking for support and help from Allah subhanahu wa ta'ala and nothing else. And I'll give you a little joke with that to strike the point home. There was this guy who was isolated, who was stranded on an island, okay, and got shipwrecked or something like that. And so he's stuck on this island and he's praying to Allah, please save me, send me back to reality or the real world, and I want to escape this island. So a helicopter comes along and wants to save him. And he's like, no, thank you. No, thank you. I'm waiting for Allah to help me. the helicopter goes, and then a ship comes, you know, and they'll get on, we're here to help you, you know, come. It's like, no, thank you, but I'm waiting for Allah to help you. And Allah's telling him, I'm sending these resources to help you, and you're not taking it. And so the same idea here when it comes to mental health and getting help, whether it's a medical or a mental health issue, is that Allah has set, you know, giving us different avenues to get that support. And it is through the knowledge of what Allah has taught us, right? To get the degrees and getting the specializations in these backgrounds, to go to these people to get the support, right? So ask those who know, which is something that is part of our Islamic faith, right? So let's take a look at the next one here. Number 8, people who experience mental illnesses cannot work. What are your thoughts on that? True or false? So people are saying false. It depends on the condition and the type of work the individual can handle. Absolutely. So whether we realize it or not, a lot of workplaces, alhamdulillah, there's a lot of accommodation, and because it's filled with people who experience mental illnesses, right? It doesn't mean just because you have it that you are no longer capable of working, but perhaps some jobs and positions, you know, are not the same level as you were before. Some people benefit obviously from change of work to support their goal, but many people work with few supports from their employer. So most people who experience serious mental illnesses, they want to work, but they face systemic barriers to finding and keeping meaningful employment. And I would say similar to people who have physical disabilities, right? So as long as that's promoted in the workplace to support and accommodate, then of course it's going to be very challenging. People may need to change jobs to find something that works for them, right? Number 9, kids cannot have mental illnesses like depression. Those are adult problems. True or false? What are your thoughts on that? So wait for answers to come in. All right, so people are saying I mostly see false. Given so many Zoom meetings and online classes, kids absolutely can be overstressed, absolutely in the last year. School closures in the pandemic have proven that. What age group are these kids? Teenagers? Then they do. So it's interesting, you know, because of the pandemic, people have become more aware of mental health challenges within our community. And we can absolutely say they can experience these challenges, right? In fact, many mental illnesses first appear when a person is younger, and it can look different in children than it does in adults, but they are a real concern. And they can impact the way a young person's mind, like how people learn, how they build skills, and how their brain develops, right? Which can lead to challenges in the future, right? Unfortunately, many children may not receive the help that they need, and they kind of slip through the cracks. And by the time they come to university, where we see them, these students have learning disorders, disabilities, and challenges, and you know, challenges such as ADHD, attention attention deficit hyperactivity disorder, or attention deficit disorder, ADD. And so they want to do their best in their academics, but they're suffering from depression and anxiety because they're not doing well, because they cannot focus. So they're concurrent. Some of these challenges can occur at the same time. And so what we do is that when I suspect that a student could have a learning challenge, is that we get them assessed by a doctor who does a mental health assessment for learning disabilities to see if that is the case. If that is the case, then we take a look at possible medication for treatment. And I've seen a night and day difference for these students, where they go from feeling depressed and anxious to actually and not being able to focus on their studies, and to being able to focus and do excellent on their exams and their assignments. And you see that the depression and anxiety is gone because it was concurrent with that disorder. And as soon as that is addressed, these underlying issues are also addressed, right? So these are things that I know a lot of our young people struggle with, and especially younger children, where we just say, oh, they're just badly behaved, they don't listen, or it's the parents' fault, they didn't raise them properly, and so on and so forth. And it's unfair sometimes, because some of these children are brilliant children, and they're not being taught or given the accommodation that they need to be able to reach their full potential, right? And I'm sure as we're talking about this, perhaps a few of us are thinking of people that we know in our community where we've seen, oh, there's such badly behaved kids at the mosque, they don't listen, they're running around, and it's because they have a different way of processing information about the world, right? So it's really important to be compassionate and understanding about that, so that we can get the help for our children earlier on, as we see it does impact their brain development, and it really makes things harder for them later. And I see that. And ironically, I see that from people who are international students, right? They're coming in from cultures where this is not addressed. They're just, given a label as not smart or dumb, stupid. Unfortunately, they've been so much pressure and shame onto that. And then when they come here, they're trying to succeed. There's so much fees involved in international student fees, and they're not doing well. So there's a lot of pressure, and it's that vicious cycle. So alhamdulillah, a lot of students who've been able to get it early on, some just cannot accept it because of the taboos and the misconceptions around mental health and disorders, that they don't want to be labeled as such, right? Anyhow, so this is perhaps the topic for another time, but it's definitely something that I see a lot in our community, right? So these patients, I work with university students. So the youngest I've had was a 16, 17-year-old youth, you could say, but we see this in our communities. Children as young as 4 or 5 years old could show these, right? If you follow Dr. Amina Yassin on social media, she is a pediatrician in London, UK, where she also talks about mental health. She works with children, and she would have more information, and she does a lot of programs as well. So check out her programs that you could join in as well, specifically for younger populations as well. Yeah. So like I said, I specifically work with that older population, and I see that in university students. So finally, number 10 here, everyone gets depressed as they grow older. It's just part of the aging process. True or false? What are your thoughts with that? So I'll just wait for people to pop in the answers here. All right. So people are saying there isn't any correlation between illness and age. It is false, 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 false. Absolutely. So the idea here is that everybody, depression is never an inevitable part of aging. Older adults may have a greater risk of depression because they experience so many changes of roles, right? And social networks as well, right? So if an older adult experiences depression, they need the same support as anybody else, right? I find this is not necessarily the case in a lot of Muslim populations, where you see the elderly have a huge role still to play in our families, right? Especially when you are living still with family, even after marriage, or bringing in a wife and so on and so forth into the household. And there's children there as well, right? I find in our communities very different because there's such emphasis on respect to the elders, our parents, and the role of family in our society. So I find that to be less. We are not the typical society where we, kind of dump our parents into, and I'm not judging those who are. What I'm saying is, like, we're not known to put our parents into elderly residents and homes, right? And there are those who have to, because let's say there are physical illnesses that we just cannot take care of our family. We need that round the clock help. That's different, right? What I mean by that is it's not part of our schema of way of thinking is that when our parents get older, this is where they go. No, rather, they still have a very dominant role in our community, in our society, which is why I tend to see less depression because of the involvement with the grandchildren, helping out families. And especially now in the pandemic, we've seen that, right? Where after being very careful of being away from our elderly, there's been now this reconnection now, and families are helping each other out a lot more as well, right? So it's the change of role in our elderly that would make them feel more depressed and have mental health issues more likely, right? Especially when they're no longer the providers, we no longer need them, right? When our parents are there because they're helping us all the time, they feel like they don't have that role anymore. They feel useless. That definitely will impact the elderly into potentially experiencing those illnesses and challenges, right? So there's also a difference between mental health, illness, conditions, disorders, right? Sometimes we can just have, a bad week or two, right? So it's a mental health condition or situation, right? An illness is more of something that, or a disorder is more of something that is diagnosed, and it's something that a doctor would diagnose and get in and give an actual treatment, which could include potentially medication. So one of my final ones here, if we take a look at it, do you think there's less depression because it's underreported? A question is asking. Potentially. I'm just giving my qualitative educational guess, you could say, from what I've observed in our communities over the years. Like I see that those elderly who are still active in the familial positions and the roles that they are in tend to show less of that depression, whereas people who don't have that role anymore, that's where you would see that. And it could very well be because it's underreported in our communities, because like we mentioned before, mental health and mental health research is still something that's fairly new within our communities and young, right? Yeah, and it could be undiagnosed as well because people are not getting help, which is then what we're going to get into the next part here. So I'm just conscious of the time. How quick is it that it's almost 8 o'clock? So just last year, one of my favorite Muslim myths is, jinn possession and lack of faith, which leads to poor mental health, not reading the Quran and not having du'as in your life. And you hear this often, like if, go and get help. Go and get help and support, and make sure that if you don't read more Quran, if you don't do this, don't do that, then yes, it is going to cause challenges and problems for you, right? But if you read Quran all the time and you have du'as all the time, you're not going to be impacted, and that's not the case, as we know and am seen, right? So it's just something really important that we've got to keep in mind, and we'll go through more of that inshallah in our future session. But just for today, to have that understanding, as we saw here from all of these misconceptions, it's regardless of that, right? It can hit anybody. Even the person with the most amount of faith could be impacted with diabetes, just like you would with depression, because there's a variety of different contributing factors that can impact that. Now, we do know, and you'll see in the next session, because I get very excited about talking about Islam and mental health, because that's what I focused my research and my graduate studies, and it's something that I'm now working with the Marja'iyya to implement across North America, is that we know there is a link between faith as well as mental health. People who practice some kind of faith ritual in their lives tend to have better wellness and mental health, right? Which then, like I said, I won't jump into it right now, but it does have a link to it. But I'll give you this example. Again, somebody who has a broken arm, you wouldn't go tell them to pray. You'd say, go to the hospital, get some painkillers, get a cast on to heal that, right? see, or your leg, and see how you can maybe pray later, in terms of being able to pray, right? So it's the same mentality. If somebody has a mental disorder or a mental break, then we have to be really careful in terms of how, moving forward, how we support the language that we use. Because if we use, oh, you should go pray, or you should go do this and that, that's not going to be helpful in the moment when somebody's dealing with a broken arm, right? So it's the same analogy. What you want to do is show support, and we'll talk about that. Again, I'm jumping ahead because I just get so excited about talking about all of this. So let's go on to the next slide here. So we've spoken about all these great misconceptions. Now let's look at some of the main barriers here. So we take a look at language, take a look at access, resources, culturally, right? Sensitive therapists. So let's jump into all of this and get into detail. When we look at barriers, when we're talking about language, I also mean the syntax here. Not just it's about the context, right? So if you tell somebody who's an elderly person in our community and they're showing signs of depression and anxiety, if you say you're dealing with anxiety and depression, are they going to listen to that? Are they going to be open-minded to that? Perhaps if we use the word that you are showing signs of sadness, you are showing signs of lethargy or a lack of interest and engagement in things that you once enjoyed before. When we use that type of language, perhaps people are more receptive to that than looking at saying those big words like, oh, I think you're depressed, right? So that type of language can go a long way. And of course, the actual language in which the person is capable of speaking with, right? So it's really important to understand that could be a barrier as well. And my curtain just really want to be part of this recording today. They are just not respecting the space. Stay, thank you. So access is also important. What does access mean here? Access means accessibility to resources, right? Where should we go to get support? Who do I talk to? And I quickly just want to jump through what that means here. So access also means in terms of knowing who to go to. Okay, a lot of us just know the word psychologist and don't really know about any other positions, perhaps people who work in the field. So I'm going to give you a quick rundown here in Canada specifically. So there's a variety of different mental health workers, right? So you have psychiatrists. Psychiatrists are people who have finished a medical degree, and they specialize in psychological disorders such as major depressive disorder. We're looking at schizophrenia, different personality disorders that need specialized treatment, right? So psychiatrists can diagnose, they can treat, and also prescribe medication. They have a stereotype around themselves that they're just pill poppers, like go in here, take a pill, see you 6 months from now. While some may do that, a majority of them do amazing therapeutic sessions and work. One time I said that in England, and a psychiatrist shot up from the audience and said, I'm a psychiatrist, we don't do that. Not all. Some, not all of them do that, absolutely. So it's important to keep that in mind. Sometimes here in Canada, they're accessible through OHIP, which is why you don't have to pay for them. Sometimes it takes a while to get to a psychiatrist because of OHIP, because they are professionals you don't pay for, they're paid by OHIP. It takes a while to see them because they are specialists. You know that when you're getting referred to specialists, it can take a while to see them. Then you have psychologists. So psychologists finished graduate studies, they have a PhD, they're also called doctors. However, although they can diagnose, and there are clinical as well as experimental psychologists. So clinical are the therapeutic ones, and the experimental ones are the ones that give us statistics, right, on research and so on and so forth, which are vitally important as well. These are the ones that develop concepts and theories and so on and so forth. They also can diagnose. They cannot prescribe medication. So that is specifically for medical doctors. They also specialize in certain fields, from anything from marriage counseling to anxiety to ADHD, like we were saying earlier, right? And so they are very accessible. However, you have to pay from your pocket unless you have insurance coverage through your work, which some of the times can cover, 6 to 8 sessions or 80% and so on and so forth. So this is, and you can find psychologists in private practice most of the time, or in government institutions and so on and so forth, research. professors as well in academia, right? PhD and a doctorate degree, that's where you find professors teaching at the university. So these are psychologists. Then you have psychotherapists, such as myself, who also have done graduate degrees, usually at the master's level. And what we do is we assess, but we cannot diagnose. So we can say, these are symptoms of depression. Let's get you to a doctor or somebody who can diagnose you to fully assess. We are the ones that do a lot of the psychotherapeutic work. We are accessible at community centers. We can do private practice, or we work in universities or high school or colleges and are accessibly usually free through the services that are available there. All of us, of course, are part of regulated bodies, just like the doctors are for the surgeons and physicians of colleges of surgeons, physicians of Ontario. Psychologists have their own regulatory body. We have the CRPO, the colleges of registered psychotherapists of Ontario. And of course, you have social workers who are very similar to what psychotherapists do in terms of getting the graduate degree and the master's, and they have a regulatory body as well. They are more around case management. You see them working with the Children Aid Society, right? You see them working in the ministry with social services and helping people access to work, access to housing, access to financial support, et cetera, et cetera. They also do therapy. Where I work, we have both social workers as well as graduates of the counseling program that I came out of. So we've covered four, I believe. Yes, four major. And then you have the medical doctors who can also have specializations. And these guys are known as GP psychotherapists. They're like unicorns. They're rare, almost impossible to find. They're amongst my favorites because they are accessible through the medical system, meaning you don't pay for them, right? And they can do the therapy, and they can diagnose, and they can give you medication. Right? So they cover everything. We have one in our office, and he is so overloaded because he also can do the assessment for learning disability. So he's our ADHD guy that we go to, and there's a huge wait list to see him. And wonderful person to work with. And like I said, if you can find somebody who can do all of that, then you are in luck for great therapy, inshallah. So I know this was a quick side, but it's a really important side to understand who are the professionals in the mental health field. A few years ago at the Canadian Muslim Mental Health Conference in Toronto, I actually did a whole presentation on who, what, when, where, and why of psychology and mental health and how to get that. So I'm trying to remember if it is on YouTube somewhere. Otherwise, that would be a great resource to access. If I have that, then inshallah, I'll share it with the group for you to check out. So back onto here in terms of resources, that could also be a barrier within our communities because people don't know, let's say, where to go, who to go to, where to even start. And usually I recommend go see your family doctor, your GP. Most GPs these days, especially because of the pandemic, are equipped to do mental health assessments. Once they do, they can either refer you to a specialist, and we've spoken about a few already, or they themselves can treat you. Usually if they don't have the psychotherapeutic background, then they will diagnose, give you medication, and say, see you in a few weeks kind of thing. But they will tell you, go see somebody. They'll refer you to somebody who can do the therapy. So resources is really important to understand. Inshallah, at the end of our program today, you will have a variety of resources to look into. Culture is also something really important, right? People of different cultural background may not want to go to a white Canadian therapist thinking they're not going to understand them, they're not going to get things. I usually get students who say, I prefer to see somebody who's of an ethnic background or Muslim because you get it. Like when I tell you I have to be home at 4 o'clock, even though it's dark outside, but I have to be home at 4 o'clock because my dad says it's nighttime because it's dark. I don't have to explain that. You get the culture behind it when your dad says you have to be home when it's dark, but it's only 4 p.m. It's dark, you're home, So perhaps some cultures may not get that, and some other cultural backgrounds do. Also the therapist itself, right? And the therapy itself. There's that misconception that perhaps when you have somebody of a different cultural background, they're not going to get it. They're not going to understand what it is to be a Muslim, what it is to be somebody of African origin, and so on and so forth. The reality is, and inshallah we'll get into it in the next session, is that when we took our courses, all of us took cultural training courses as well, which help us understand that although we may not understand a specific culture or faith, we have an understanding of how to use culture in therapy, right? And of course, it's much easier when you go to somebody who gets it and understand it. And what's interesting is that you even have Muslims who prefer not to go to another Muslim from the same community, thinking they're going to know everything private. They're not going to be confidential, right? And it brings us to the last point, shame to the family. People may not go and get help because they are worried about word getting out. They're worried about what are people going to think when they know that somebody in our family member had a schizophrenic breakdown or a suicidal attempt. What are people going to say and think? And so there's that shame to the family of disclosure when you take things outside of the home, right? So these are some of the barriers. There's a lot more, I'm sure, that you could think of. Just seeing here the comments of people, I can see here, yeah, lack of knowledge and information on this topic could also be another barrier. Absolutely, especially those who are suffering themselves. Yeah, which brings me to my next point here, is that even those, why is it that, I'm jumping ahead because of the time here. Usually I get people to help me with these and answer with me, but let's take a look at this. Why is it that, they should be accessed? Why do we access these supports? Well, number one, to help process changes in our lives, right? Helps us get back to baseline functioning, right? Sometimes we get off track with illnesses or different challenges in life, and we look at, we work through different traumas, perhaps, right? Crisis, life struggle, change, divorce, death, moving away. It's for self-growth, right? To learn new skills and boundary setting, support through the different challenges that we can experience. And I see a lot of people who are lonely as well, especially during the pandemic. Loneliness and isolation has increased quite a bit, right? So not trusting others, no one to talk to, and the counseling setting can really help people with that, of course. So we have taken a look now in terms, I'll get people, or some of you probably have already seen this. What are, some of the most common illnesses within the community? By the way, just a little bit before that, to the point that somebody mentioned here, even people themselves who are struggling, they wouldn't go get support themselves because of a lot of these barriers that we spoke about. So here's the question. Why do you think that mental health resources should be accessed? Actually, I jumped ahead. My question is, what are the most common illnesses? Because I have two different slides going on here, one with my notes and one without. So what do you think are some of the most common illnesses that we see in the Muslim community? What do you think, Sister Tuba?
I think I would say depression.
Depression. Yeah, depression, anxiety. Yeah. Definitely somebody mentioned that as well. Anxiety, yeah. Depression, those two would be amongst the top two, absolutely. We can take a look also, suicidality, that's also pretty common. If you look here, these are the most common across the general population that also happen within our own, right? Take a look at addictions, right? And it could be substance abuse, it can be drugs, alcohol, but it also can be gambling. It can also be pornography. And interestingly enough, the last few years, the Muslim Youth Helpline in the UK did a survey on pornography, and their research showed that there's actually been an increase in women being addicted to pornography. And when we looked at the reasons behind that, it was because of the lack of sexual education in our communities, right? There's a lot of shame around that, a lot of taboos, like, you don't talk about it. And you have young people getting married and they have no idea, what the marital rituals and rites are, and so on and so forth. And it can cause a lot of tension, and it can cause a lot of problems and misunderstandings. This lack of education, of course, people can find different ways of gaining knowledge, but of course, in a knowledge that is not healthy, right? So it's really important. And over the last few years, once we started really talking about mental health within our communities, we've also been having private discussion circles on intimacy and sexuality and understanding this within our community, especially in the society that we're living in now, right? So there's a huge bombardment of everything outside for us. So we need to be able to equip our young people in terms of knowing how just to educate themselves, right? So they don't turn to other means of getting these knowledge, because they can easily access it off the internet, peers, everything is accessible these days. So we want to make sure that we are the ones who are providing this knowledge. If it's too hard as parents, then in our communities, that you bring people who are qualified to teach our kids this, right? All right, so moving on here, I want to see more interaction from our audience. What are some other mental illnesses or disorders or challenges that we see within our community. What about mood disorders, right? Borderline personality disorder, bipolar, narcissism, these are pretty common. And these come out in the form of abusive relationships as well, right? Which is another common one. Somebody mentioned schizophrenia as well, right? That's also something absolutely that we see. We don't really talk about because we don't really understand. Negative self-image, absolutely, when it comes to identity. How about cross-generational, right? Cultural issues, clashes with our generations, right? Then you've got identity issues. Somebody mentioned negative self-image, absolutely, especially when it comes to Muslims, especially when it comes to Islamophobia that we've experienced in the last few years, right? Somebody mentioned PTSD here. What percentage of Muslims suffer from PTSD? As many come from war-torn countries and have suffered from major trauma. I don't have an answer to that. However, I'm sure there are articles out there that can show that. Again, it's fairly new in the Muslim community. I mean, all we have to do is look at what's happening in Palestine these days, right? In Palestine, to really understand trauma. And a few weeks ago, if you go on the Muslim Counselor YouTube page, actually did a full session on trauma. And we did one last year as well after the Beirut port explosion. So we were looking at how trauma can affect us and how to work through it. So I highly recommend for those of you who are interested to look at those, and you can see that, right? To get more resources and understanding of that. But definitely when we take a look at that, PTSD is definitely something common within our communities, given the world that we are living in now. And then we take a look at issues related to domestic violence, abuse, sexual abuse, child abuse. And when we take a look at domestic abuse, it is not just against women. You see there are also households where men are also being abused by their partners, their wives. And it looks different. It may not necessarily be the typical that we see in our minds, the physical abuse, right? It's also mental abuse, financial, sexual, all of this. And I've also done programs on that. You could see that on the Muslim Counselor YouTube page. Islamophobia, like we said, and some of us mentioned schizophrenia. There's also OCD, obsessive compulsive disorder. There is also eating disorders, right? That's something that I've also seen people experience as well. And there's so much more and more. These are some of the common things that we see within our community. So if we go on to the next slide, I know there's a massive information here. So let's quickly take a look at some of the signs of depression and anxiety. So these are some of the common signs that we see. And persistent sad or anxious empty. So I'm just expanding it here on my screen. So you can see here a variety of different symptoms. Could be from pessimism, hopelessness, right? Decreased energy, fatigue, feeling slowed down, restlessness, the change in our sleep, our appetites, right? So there's that slowing down, and anxiety tends to be the opposite of that, right? It tends to be more around feeling restless, perhaps feeling nervous or tense and heart racing, shaking, and it could be fatigue as well, right? Ongoing thoughts, difficulty concentrating and focusing. So there's a lot in here that we see that could be happening. And the idea is that it consistently happens for a period of over 2 weeks, right? Because we all have our ups and downs, like we said. However, when you have it over a consistent amount over 2 weeks, then you see how it can really impact you. Where, again, what we recommend is going to see a doctor to get the help that you need. So let's take a look here next at what counseling is. So essentially, the definition in the dictionary when it comes to counseling is the professional guidance of the individual by utilizing psychological methods, especially in collecting case history data, using various techniques of the personal interview and testing interest and aptitudes. And what we see here is a scary definition almost, right? Like, ooh, that sounds pretty complicated. And I'd like to simplify that by giving you the definition that I like to share with my clients when I first see them, right? So essentially, counseling is a safe, confidential, open space for you to talk about whatever it is that you bring here. And what we do is we help you to reach your goals working with your problems or provide you with strategies to cope with your challenges. So we don't actually fix your problems. We don't get rid of the depression. We don't change your life. But what we do is we take a look at strategies to help you manage and cope with these challenges, or even looking at different ways of making changes. It is absolutely a place of no judgment, just acceptance, no matter what you bring in, right? Sometimes it could be short or long term. And a variety of things I talk about with my clients, especially student population, is stress, anxiety, depression, relationships, school, family, work, and the list goes on. If it's something that I cannot help, then I absolutely do refer. Now, because I work in the university, I cannot do private practice right now. I just don't have time. I work full time. So when people ask for counseling, I can't provide that, but I can absolutely refer you to people that I know who do have a private practice and can absolutely take clients, and they are Muslim and from our communities as well. So why do people avoid counseling? Why do you suppose that is? Can we have some answers? I'd love you participating. Why do you suppose people avoid counseling? Some of these things we've already spoken about, right? It could be around stigma, fear, like we said, people find out, shame, weakness, right? Because you have low faith, right? You're not being a good Muslim. It could be shame of disclosing personal and family issues to outsiders, right? That can, especially, let's say people who find out from a family, it could perhaps reduce the marital prospects because you have this type of attitude is that, oh, this family is known to have somebody who is schizophrenic. You know, we don't want to marry into that, right? Perhaps finances as well. Absolutely. That's why I encourage you to go to your family doctor and get them to refer you to a psychiatrist or somebody who can have it covered by OHIP. Absolutely. So somebody saying we may not know that we have an illness, right? That we don't know what the signs are, privacy problems, scared unintentional information may leak, right? Sometimes people may not be aware. That's another thing, right? So that's the thing. Why is it that, let's say that even people who are struggling with mental illnesses, why don't they seek help, right? So this is the same thing, right? They'd rather deal with it on their own than show that weakness, privacy, right? There's also the denial of the illness, because it becomes real when you have to face it, right? And I see that a lot with students, especially coming in from abroad, let's say when it comes to depression or ADHD, they just don't want to face it. They don't want to deal with it. It becomes real, right? So is counseling only for people who are affected with mental illnesses? Is it only for those people? What do you think? We know that's not the case, right? We know that it's for people, let's say, some people like the long-term counseling of talking to somebody, you know, every month or every week, just having a space of release, of getting things out, right? Processing things, that helps them. Sometimes a third party objective, right? It can give a professional opinion about a certain situation. Till now, I have people that I've counseled more than 13 years ago. Just somebody on LinkedIn messaged me the other day and said, you know, we've never forgotten. They moved back to the UAE and they said, we've never forgotten the support that you provided us at the time. And we really appreciate that. I'm like, wow, that's amazing. Years later, you hear back from them that, you know, that short-term counseling they had when they were a student, an international student here, that really helped them succeed. Alhamdulillah, years later, you know, they send Eid Mubaraks and remembering them in the dua. So it's amazing. That they come and get the support even though they didn't have a mental illness. They needed a space to talk about challenges they were experiencing in their lives, right? So absolutely. And somebody mentioned the family members of one who has, absolutely. So for family members who have somebody who has a mental illness or a disorder or a challenge or anything like that, having that space can be very helpful to getting strategies on how to cope with this difficult situation. Even if you have, let's say, a family member who is ill, physically ill, or an elderly parent or an abusive partner, God forbid, right? So having that space can be really, really helpful, even though you may not have a particular illness yourself. So these are taken from an article here that you can see here. It's fairly outdated, but it talks about mental health stigma in the Muslim community. I need to update that because I know there are newer journals now, especially if you look at the Muslim Mental Health Journal. They actually do a conference, a yearly conference as well. So let's take a look at this fun part now, gender variances. I've touched upon it a few times, especially at the beginning. So let's see if those who were listening can answer now. So let's take a look at this. Muslim men usually deny or have more negative attitudes towards seeking help. Why do you suppose that is? Duba, what are your thoughts on that while people are typing in?
Yeah, I think the first thing that comes to mind is like, is that it wouldn't be considered like quote unquote manly to get help. So I think that has to do a lot with like it's considered like, or I guess in society it's considered unmanly to seek for help.
Yeah.
Or yeah.
Absolutely. That's definitely an aspect. What else? See what our audience members are saying. Just waiting for people to pop those in. Other than that, sister, what else? What else comes to mind?
One thing that just keeps popping into my mind right now is just like be a man. I've heard that saying a lot.
Yeah, that's a good one.
Yeah.
Yeah, like can you like expand on that? What do you mean by be a man?
I think with being a man, usually I think the impression is, or the consideration is that men do have a lot of responsibilities of providing for their family and working. So they will be stressed, and that's normal. It's normal for them to have these to have like mental health issues. So it's not something that they should be seeking out help for.
That's a big one, right? Like the way our males are groomed from children is to keep the tears in, keep the emotions in. Do not show your emotions because you got to be tough, right? Like men don't cry, boys don't cry. You hear that often. That has a huge impact on the children, the young boy in society, you know, being raised that you're not supposed to show your emotions. It's not okay. It's not okay to show your emotions, right? So this can be part of the problem as well. Absolutely. What else do you think, sister? Challenging you today.
No, it's good. Like I think it's really good to reflect on.
Let's see here what our audience is saying as well. What are some comments? Can you also see the comments?
I can, yeah.
Okay. Let's see here. Some of these comments. Wow, mashallah, so much here. Man ego. Busy providing for families. Some see it as excuse. Men in general take time and need some convincing to seek to look after their health, physical. Men don't usually like to discuss their private affairs with strangers or outsiders. Ego, again, men in general may be less in touch with their emotions than women. So I was having a discussion yesterday with a Sayyid talking about gender variances in men and women from an Islamic and psychological perspective. And this was one of them. We were talking about perhaps feminine qualities in both genders, right? Like where men would show their softer side and that's not considered masculine yet. You know, you see Imam Ali alayhi salam, who was the epitome of this warrior strength of a man who was gentle and helped out in the household, as documented in our hadith, right? So it's interesting to see, well, he's the manliest of men that we have in our history and that we look up to. If he can do it, who are we not to, right? So it's really interesting when we have that discussion. There's also they may not be able to or willing to talk with close family because of societal pressure. For all men and women is often a lack of knowledge that leads to not recognizing that they have a condition, as well as not knowing to seek the help or guidance. So we've got some great answers here. And absolutely, it's all of the above. It is the way we are raising our young boys to young men to adulthood in terms of not being able to share. That can be quite damaging and harmful. And I have a book back here. Just gonna grab it. And it's one of my favorite resources that I like to use when it comes to communication. So a little bit off track here. If we take a look at this book here, Men Are From Mars, Women Are From Venus. I'm sure you've heard of this book before. It's a wonderful communication resource that I use in therapy with my clients when it comes to relationships. And this is something you can use across all cultures, I would say, because I've had people who are Indian background, of Chinese background, of Arab background, of Canadian white background, who pretty much said the same thing. And I've read this cover to cover. You see all the notes I've taken over the years. I actually went and bought the entire series of after I read this first book. Another book is about stress, how men and women deal with stress differently. There's also a book on intimacy and also daily reminders. Why do I recommend this series so much? Because it really gets to the in-depth understanding of the male perspective and the female perspective from this therapist who's got over 40, 50 years now of experience. And incredible how he talks about communicating between the genders in a marriage, in a relationship. And he talks about how men, and you know, we're describing it here, men are processing, you know, they are, what is the example? Like rubber bands. Men like to go to their caves, he describes it, because they're like rubber bands where they stretch. They go to their cave, they do their processing here. And if the woman is not being supportive of her husband or partner going into the cave, then he doesn't come back strong, as the rubber band example. Whereas if when you are supportive of your partner, caving means processing, essentially. Could be video games, could be going on his phone, could be, you know, going out for shisha with his friend or being away, you know. And man cave, there's also examples of, you know, he's got the man cave, his office or the garage or the gym, right? I am totally stereotyping, but I'm giving you examples that are used in the book and I've seen also, right? So when you give that support, like, hey honey, you know, Allah Yasa'adak, you know, may God help you, or, you know, I'm just going to go shopping, or I'm going to go do this. You're letting them know you're there for them without saying, what are you doing? Why aren't you talking to me? The worst thing that we can say is that, right? So is you showing support? If you need me, I'm here. And you just give them that space and time, and then they come back like this, like it describes in the book. Women, on the other hand, what do we do when we have a problem? What do we like to do, Sister Tuba?
Talk to our friends.
We like to talk. We need to express it. We need to let it out. We need to go into the gory details. And as described in this book, the author describes women as the home improvement committee, where the men are the Mr. Fix-It, right? So when a woman goes to her husband and starts talking about a problem that she has, what does the husband do immediately? He then starts providing solutions to the problem, when all she really needed was somebody to listen to her. She doesn't care about the solutions at this point, unless it's like, what should I do right now? So you lend that ear, that support, that, oh, there, khatiya, oh, I'm so sorry, you know, support, you know, that kind of thing. That goes a long way in helping your partner, right? So I'm just giving you little tidbits that I highly recommend you get this book, read it cover to cover, and perhaps in the future we could do a workshop on communication with in marriage, because I've done something like that before, and it's always great fun to get the different opinions and interactions of others. Essentially what you want to do is bring communication closer, and this helps us answer our questions here, right? We know that men are brought up in a different way when it comes to emotions, and what's ironic is that our own faith teaches us, right, that we are allowed to show emotions, especially if you look at Muharram, right? Both men and women are encouraged to show emotion, encouraged to show tears. We see the imams showing grief at the loss of what happened in Karbala. We see Imam Ali alayhi salam crying for Sayyidah Fatima az-Zahra, crying over the Prophet sallallahu alaihi wasallam when they were martyred. So you see, they were expressing and showing that, right? We are encouraged in the majalis to release the tear for Abu Abdullah, right? And when we look at it from a psychological perspective and the scientific aspect of it, when that tear comes down, there's a release of toxins in the tear, which is why you feel so great. So imagine the blessings of both releasing the toxins and the blessings, the barakah that you get in the majlis when you are crying, right? Now, we're not saying, you know, to just be crying 24/7, no, but when you are feeling that pent up of emotions, inshallah, in our third part of our series, we'll get into more detail with that. I'm conscious of the time. I'm going to speed up this last part here. But finally, let's look at this question. Is it true that mental health illnesses affect more women than men in the Muslim population? True or false? thoughts? What are your thoughts? I'm just going to type in the name of the book here.
Thank you.
So what are your thoughts on that, sister, while I type away here?
Yeah, I think, reporting wise, yes, I think it does affect women more than men. But I guess like based on the first question, maybe men don't seek help. So we don't have like the true numbers.
Yeah.
Mhm.
So here it is. Somebody saying it affects both equally, give or take. It could, but because it is underreported, like you said, most women, will tend to get the support, right? So the statistics, I would say it's strongly gendered, with women expressing higher levels of need for mental health services than men because of the negative attitude of seeking help, right? And like we said, it's in our nature that the female tends to be more expressive in her emotions. We're used to speaking about our emotions with each other. Men are not, perhaps, right? So this moves us towards being more open. In the last few years, there are more trends where there's men's mental health, right? Movember, right? There's been an increase of providing safe spaces for men to get the help that they need. Absolutely. Definitely in the workshops and events and places that I've attended, we've spoken about that. And it's not true that women tend to be affected by mental health more. It's, again, with what we were saying, this is also in the Muslim community as well as in the general population, right? And it's all about that. It's about that attitude that, men don't cry. So it is underreported that men are seeking help, right? What's ironic is that most of the clients I see when it comes to the Muslim population tend to be men, tend to be Arab men.
Oh, wow.
Yeah. And I find it a positive thing, because once they seek to get help, they'll go tell the others, come and get the support. Mostly international students who are failing because they've gone into bad lifestyles. They're not getting good marks, and they're terrified of their parents finding out. So they come to get the academic support, and we take a look at, backdated withdrawals, getting academic supports here, getting support from this professor. Let's see what we can do about this grade. And then they have the space where they have somebody who understands and gets it. And then they go to the younger students and say, hey, don't do what I did, go get help, kind of thing. So that was really fascinating to see that. So let's move on to wrapping up near the end here in terms of taking a look at support. How do we support a family member or a friend? So it's really important that we listen, right? Listening entails being accepting, not judging. Somebody comes to you and says, I've had thoughts of harming myself. I've had thoughts of, these types of thoughts. We can't say, haram, you can't think about that. You're going to go to hell if you are going to thinking of killing yourself. That's placing judgment. You're going to push that person away. They're not going to come to you for support. They're not going to feel accepted, right? So even if they come to you talking about things that are not, let's say, halal or acceptable in our faith, that's not going to be conducive or helpful if you just throw and be the haram police, right? What you want to do is create that safe space for them, accepting even if you disagree or do not like. Next thing is you want to encourage them to get the support, right? You are not a counselor. You shouldn't take that on. Even if you're a counselor, unless you're in a counseling setting with that person, if it's a crisis, then get the appropriate support, contact 911, get them on the distress call line, right? So it's really important to make sure that you encourage the appropriate counseling to get that support. Again, what did we say? Go see a doctor, and then the doctor can do the referral. There's this really great article here, how to support a friend or family member with a mental illness. How can I help? What do I do? So you can access that, inshallah. There's lots of resources out there now that also get to that. And in our next sessions, inshallah, we'll get into a lot of detail when it comes to the importance of self-care, right? In our last session, we'll do that, inshallah. But it's really important to do ask for help, because it shows great courage and strength. Quite the opposite of weakness, right? It's important to do that, because in order to take care of your health, you're not going to be able to help other people if you don't take care of yourself, right? And a quick few things of what that looks like is having that routine and balance, making sure healthy eating, healthy sleeping, exercise, having the spiritual inner peace. Absolutely. Like we said, there's a huge link of faith and spirituality along with healing and mental health. Medication if needed, right? Because just like you need insulin for your diabetes, there's definitely this aspect as well. Good relations with friends and families, cutting out toxic family members and friends. I know there's the aspect of sulat al-raham, which means keeping your basic connection with them, sending salam, Eid Mubarak. Now, if it's somebody that you're living with, that's a whole other story to deal with. And I've talked about that when you look at my YouTube channel, when we looked at toxic relationships. You can check that video where we talk about how to cope with that, because there's a whole process to dealing with living with somebody. So I ask you to go check that video out, and inshallah it explained fully there. Of course, as a counselor, I'm going to recommend getting counseling support as needed, inshallah, or speaking to somebody, a sheikh or a scholar who has the counseling skills as well. Finally, resources, right? So you do have a service in your community. It is called the Muslim Social Services. They actually had a program today called Wellness in the Face of Islamophobia Part 2. I'm assuming there's a whole series to it. So please do check that out. There's the link right there. You can Google them, check them out, and see if there's I think their website's under construction right now, but that is a resource that is available in your community. Also, you have the Jafari Support Services, which is not too far in the GTA area. They have a counseling service there as well. They are always putting different counseling programs online. So check out their Instagram page. I'm always resharing their programs because I love what they do. I've worked with them as well. So they've got great online programs. And then you have Sister Marzia Hassan, who is in the GTA area. She is a counselor as well. You have Zainab Abdullah, who's Arabic speaking, also in the GTA, who does counseling. Believe it or not, there's so many more people now doing online counseling than in face-to-face. So it's so much more accessible now than it was before. You also have the Muslim Youth Helpline, the Nasiha. I've worked with them. They're highly recommend them. Use this resource if you want to talk to somebody. They will also be offering counseling as well, inshallah. So this is by the grace of our community and through Allah subhanahu wa ta'ala, where people have seen the need for counseling in our community and have been donating and supporting this cause. Now they can offer actual counselors for people. And what's exciting is that they have a building now that's being put together. And this is from the community supports that have been donated to the different fundraisers that they've had, building an actual counseling center. How amazing is that, right? So you can see I get excited about that because as a graduate student years ago, I never would have imagined where we are now compared to when I first started. Because when I first started my research, as I'll point out in the next session, there was hardly any research out there, much less services, mashallah. Also here in the Ottawa area, we are just starting up. I don't have it written there, but please do follow it. We're going to be going live soon on social media called Sakina Wellness Services. SWS will be starting soon. This is a Shia support. I don't want to promote it as Shia, but it is started up by Shia group of professionals. It is for all Muslims, of course. But it is something I'm very proud of from the Shia community that has come up as well. Inshallah, it's building. It's been in the works for the last few years, and inshallah, more and more to come, inshallah. So then you have the CHMA. So if you're looking for mental health services, then you can just go on this website and it also can direct you. Finally, you've got the mental health first aid training. Now, these are amazing trainings that I recommend each of our community centers get this training. Bring in somebody from that program to train members in your community to have basic mental health aid, right? It's just like getting first aid training. You get mental health first aid training, where you have certain members of the community who have this training that can be on the lookout to be the kind of, I wouldn't say first responders, but just like first aid, if somebody's saying that they're feeling this way or that way, then this can go a long way in helping as well. And finally, what do we have there at the bottom? Assist. This is also a great training for community leaders, just like the first aid, to have the suicide training. This is something that as counselors we have all had, and anybody can get this training. So it is worth it when we talk about what can a Zahra Shia Association do, or any community center in our centers across Canada, is these basic trainings for your community leaders, the youth leaders, the sheikhs, everybody, to get these basic training to normalize mental health. So people, when they come to you, you know the 101s and what to do. Makes sense, right? Finally, I've got some great books here. I usually have them, but they're not on me right now, but you see them here on screen. So Counseling Muslims is a great book. It's comprehensive. It is from our Sunni brothers and sisters. However, it's pretty comprehensive when it takes a look at different disorders. It's a great handbook. And then there's this other book here that you see. It's called The Counseling Psychotherapy with Arabs and Muslims, a culturally sensitive approach, which is very good for both practitioners and people who want to learn more. And finally, you see this book here is called All the Perfumes of Arabia. It is a book that I've actually reviewed and given a review for it. And I highly recommend you get this book. It's also supporting a local Shia brother who has written this book. And each chapter talks about the different perfumes of Arabia. One in particular, there's a chapter on mental health. And that's, of course, the one I focused on, but I read the entire book. And this chapter on mental health talks about lavender and scents to help with anxiety and mental health. And the author himself discloses his own challenges, which is all about normalizing mental health in our community. So I highly recommend this book. There's, like I said, the Muslim Mental Health Journal, the Muslim Mental Health Conference that were not there before that are here now, to check those out. Finally, I always like to end off this part of our series with this beautiful hadith that has been attributed to Amir al-Mu'mineen, Imam Ali ibn Abi Talib alayhi salam. And I'd like you to, I know there's a ton of information thrown at you today, so take a step back and just, close your eyes and just relax the muscles in your body and just sit in a comfortable position as I say this beautiful hadith, which says, "Your remedy is within you, but you do not sense it. Your sickness is from you, but you do not perceive it. You presume you are a small entity, but within you is enfolded the entire universe. You are indeed the evident book, by whose alphabet the hidden becomes manifest. Therefore, you have no need to look beyond yourself. What you seek is within you, if only you reflect." And inshallah, today, with this reflection upon learning about what mental health is, the different misconceptions that we have, the resources, the limitations, and so on and so forth, inshallah, you've had a lot to reflect on as the first part of our series, and moving forward, inshallah, that we can apply in our next one, next Monday, on Islamic theories, counseling, and practices, and our final one, inshallah, on mindfulness stress release. So I'd like to end off this section with the salawat ala Muhammad wa ali Muhammad. Allahumma salli ala Muhammad wa ali Muhammad. Open to questions and comments.
Well, first of all, thank you so much. That was mind-blowing. Like, there's a lot to learn, and I really liked how like the way that you described everything was like, it was easy to understand. Like, it wasn't like lecture based. It was just very easy to understand, and it was really interactive. So thank you so much. That was incredible. So we do have questions lined up, so I will get started on those. Okay, so first question, how can we as a community help someone who does not want to be helped? So for example, like if they're going through addiction, but the individual says they're fine, or like they don't need any help, how would we face that, or how would we go about helping them?
So this is very challenging. I'm just going to stop the screen share because I don't think we need that anymore right now. Although I do want people to take away with them, what is one thing that you learned today?
Sure, absolutely.
All right. So how do I remove the screen share? So while you're doing that, oh, here it is. Yes. There we go. Now we have a normal screen. Yeah, there we go. All right. So how is it that we can help somebody who doesn't want to get help? Well, it's really tough because you cannot force somebody who doesn't want to get help, right? There's only so much we can do to support and help them and try to encourage them. This whole time I've had my my beautiful scarf from Ziara stuck behind me. Let's bring it up to the forefront here, right? So essentially what we want to do is to create that safe space for that person to feel, not to feel shame, to feel that they can come to us and accepting of their challenge, right? If giving them the opportunity and saying to them, I'm here for you. Like, what if we go together to go get assessed? Let's go to the doctor together. Why don't we call an appointment together? I'll come with you, So using that compassionate, that non-judgmental attitude can go a long way in helping somebody who may not want to. You can tell them, you may not be ready now, but I'm here when you are. I'll be here for you when you want to get the support and help. So that's also another way of approaching it. Sometimes you need a really hard, intervention, right? So get a few people together and say, hey, listen, we're really concerned about, your addiction. We are really concerned about your depression. We really are worried about you. We really want you to get the support, et cetera, et cetera. We're here to help you, and so on and so forth. Sometimes it could go as far as needing to call 911. If somebody's not willing to get the help and you see that there's a danger there, sometimes we need to go that far, So it truly depends on the person, the circumstance, the situation, and how we go about it from there.
Thank you. The next question we have is, it's very common within our religion for many to say you're depressed, read the Quran, or to minimize one's mental health problems by simply saying that Allah subhanahu wa ta'ala does not burden a soul beyond what they can bear, and giving no other support or acknowledgement. How can we help change this mentality?
Allah does not put upon us more than we can bear, also by providing us with resources to help us bear with these challenges. That's how I would respond to that, right? Although he gives us these challenges, inna ma'al usri yusra, right? With this usr, there's yusr, with means getting support. With means reaching out, getting support. But it does not necessarily mean specifically from the Quran. And yes, every problem, there's a solution in it in the Quran, and the Quran will tell you to go ask those who ask those who know, get the support from elsewhere, right? And there is a healing in the Quran as well. And in our next session, we'll look at that in more depth. So let's leave that question in more depth next time. However, like I did say, that Allah gives us the resources to help us with the things that we cannot bear, and to understand that there's also a science behind the support that we can get from du'as and healing from the Quran. Absolutely. And those are the natural methods of healing. And like I said, next session, inshallah, we'll get more detailed with that.
I agree. And I feel like it aligns with the example that you gave of that child who was stuck in the island and him getting help with the ship and the boat and not. So I understand. Yeah.
Like refusing that help, but it was truly Allah who was sending that help to him, right? So sometimes we slap away the help that comes our way that is from Allah subhanahu wa ta'ala.
Exactly. Okay. So what's mental illness according to cognitive psychology and Islam? So symptoms such as perception, illusion, hallucination, and suspicion. So I think the question might be referring in terms of, I think, like jinn, like hallucination, and
so there's illusion. A fine line. There's a fine line with that. I've worked with a sheikh before who does spiritual healing, and he has said he's gotten people that he has tried to help and it doesn't help, because we do, and I forgot to mention that earlier, we do acknowledge this in Islam. There is an impact of the spiritual world and jinn, right? And it's written in the Quran, right? The evil eye and the impact of evil black magic and all of that. There is that. It is acknowledged in Islam, right? But there are people who may not. There are scholars who don't, right? And there are scholars that do. And we do see an impact of how it can harm people. However, if the sheikh himself is telling you, I can't heal you, you need to go see a doctor, there's only so much spiritual healing I can do. This is a bio or a chemical imbalance now that you need medication to put that into balance. This is where you go to the emergency, go see a psychiatrist, go get the support and help that you need.
I guess a follow-up question for that would be, and I know that you mentioned this in your resources as well, but I guess I want your opinion on this. It would be a good idea for all our our maulanas and even for example our madrasa teachers to get some sort of a training,
Absolutely.
not to assess them, but to kind of guide them and direct them on where to go.
Absolutely. I mean, if you look at our sheikhs, they are frontline workers, mashallah. They are the first to go in our community, right? The go-tos. So it's truly important. And I've been saying this for years now. And subhanallah, there's a few sheikhs who are on board of this, who themselves are going to get the training. They see how important it is. They are the ones that people go to for marital problems, or their problems with their youths, their adolescents, right? Or their kids. But they don't have the frontline therapeutic training. So some of these sheikhs, and I can name a few, Sheikh Nuru Muhammad in Birmingham, UK is doing that. Sheikh Muhammad Jawad Shamali, he himself is getting that training, right? So they are recognizing how important it is to have, of course, when you've got your Islamic background and you want to be able to provide that therapies to get the actual training in it, right? So it's really important and so beautiful. You'll see in our next session how they do go hand in hand and how they're all towards the same goal, right? And I've been supportive of that. I've been promoting that. I've been doing that. Inshallah, maybe one day we can do training for sheikhs, especially working with the marja'iyya at the large scale like that. We definitely want to be able to do that. The fact that the marja'iyya of Sayyid Sistani acknowledges and recognizes, and we're doing programs with them, that tells you something right there. Right? That's a lot. And when you have that kind of validation, then it makes it easy for people to say, well, I'm going to go get the support. Oh, I'm going to reach out and ask for support and help. So that's really important. And I encourage those who are interested to pursue it. We need more people in this field, in this background, to get the educational background along with your Islamic training. It's such a beautiful mix to be able to provide that support with people. You can have somebody who come to you with suicidality, like we mentioned a few times. And if you don't have the proper skill to assist somebody to get out of that, then that's an issue. The basic training that sheikhs can take right now are those courses that I mentioned, the mental health first aid training, and any of your community leaders, as well as the assist program. These are great starters. And like I said, great front line. When you see somebody choking, you've got first aid, the basic things to do, the Heimlich maneuver and giving CPR. These are basic. It doesn't make you a doctor. It doesn't make you a paramedic, but it makes you somebody who knows how to respond, to be first responders. Same thing, same concept here. So absolutely, I support that, promote that. I encourage that. I don't have the mental health training to do the mental health training because that's a whole other course. It's a $3,000 course that trainers take, and we have to upkeep that training. I work full-time as a therapist. I don't have time for that, but I do these types of mental health awareness. It's not training, but it's mental health awareness. So training is different. It's very different. And it's really important that our community members get that training, inshallah.
SubhanAllah, that's wonderful. Thank you. So our next question, in Surah Nam, ayat 43, it says, it's Allah subhanahu wa ta'ala who makes us laugh and cry. So is mental health, mental health is normal? Question mark.
In terms of the ayah from the Quran, I wouldn't be able to interpret that, as I don't have the Islamic scholarly training for that. So I highly recommend you mention that to a scholar and get the interpretation with them. But the last part you said, so mental health is in Islam? Absolutely. Absolutely it is. If we see right from the beginning when we talked about the wellness aspects from the quote from Imam Musa al-Kadhim, right? That is talking about balancing our mental health with aspects of wellness, right? So like I said, inshallah, in our next presentation, we'll get more in depth with those. People are really excited about these concepts already, mashallah.
No, it was, I think it's after a very long time. Actually, I think this is not after a long time. I think this is one of our first mental health seminars. So lots of questions and thank you so much. I think we have one more question that was submitted. I
love how everything's interactive, that they can just send a question and then you bring them. People can even ask on YouTube if they're comfortable.
Yeah, for sure. Please do. Okay, so what can we do to help debunk myths about mental health within our community and better educate our community members?
So send them this video as a start.
Nice. Okay.
Attend these workshops, absolutely. When you become familiar with the lingo, with the language, with the statistics, the commonalities, you become more comfortable, right? It becomes less foreign, less strange, less scary. I'm sure a lot of you who are watching now, and I'd love to hear feedback. I can post it on YouTube for those who are listening. Do you not feel more comfortable with the topic now? It's not as strange and foreign. It's something we can all relate to, we can all connect with. And like I said, you will now become ambassadors, that you are going to be taking this out into your community, normalizing it, being able to talk about mental health just like you would about physical health. You know how people have all sorts of different illnesses and they almost brag about all the medications they take, right? You've seen that in our community, but you don't really do that when it comes to mental health because there's a different view on it, right? And it's just about normalizing it. When your Al-Zahra Shia Association puts on a program like this, you are normalizing it. You're doing it already. When our centers, when our marja'iyah, when our Hussainiyas, when our mosques are putting these programs on and you're bringing in mental health professionals side by side, working with the sheikhs and presenting. And usually I do these programs with the sheikhs in person, and we'll have the sheikh talk about it from an Islamic perspective. And then you have this presentation, and it's such a beautiful mix of that. And then when people see their sheikh in their community or another Islamic scholar talking and validating, there's like, okay, there's a relief, there's a comfort there, right? So there's so much that we can do about that. And mashallah, you guys are starting already by doing such programs. And inshallah, once this pandemic is eased up, we'll be able to come into your city and do these types of programs and do for really great programs with the youth and the parents, communication with the women, all sorts of things that we can do in person, inshallah. And that in itself will help also destigmatize as well.
Inshallah. No, we definitely look forward to it. I don't think we have any other questions. I'm just gonna double check YouTube.
Yeah, I don't see any questions on that. Just beautiful comments. Barakallahu bikum. Thank you for your participation as well. This is really interactive, alhamdulillah.
Sister Bar, I did want to mention the resources that you had provided in one of your slides. I know that the video will be available on YouTube, yes, but would you be able to provide that to us in written so we can forward that email to our community members?
Inshallah, I'll send that over and then you have access to that as well, inshallah. Don't forget to also, a lot of the resources I share also can be accessible through social media. For those of you who use Instagram or Facebook, please do follow the Muslim Counselor. I'm always sharing resources of therapists, of online resources. I'm always sharing programs as well. So highly encourage if you want to. There's also in Telegram, I don't really use it that often. I should though, because I know some of our community members like it. I'm always putting events in there as well and articles. So just look that up on social media, the Muslim Counselor, and inshallah, that can be also as a form of a resource. But honestly, there's so many resources out there now compared to what we had before. It is always a pleasure to see that. I get really excited when I see more people getting into this field and encouraging our young people to get more into this field. It's really important because you're combining Islam and science together in a way that is in a form of khidmah, in a form of service to our society, right? What better way to prepare for Imam al-Mahdi? Ajalallah ta'ala al-sharaf al-farij. I mixed it up. Sorry. Ajalallah ta'ala. Help me out. COVID brain just froze me here for a second. In any case, the idea, what better way to prepare ourselves for the Imam than taking care of ourselves, right? Mind, heart, body, and soul, all around. And when you're holistically, helping, putting yourself in that frame of mind, this is how you can be of service to the Imam, right? What better way? Not just with education, not just physically, but also mind of heart, body, and soul together so that you can serve, inshallah. And I always try to link that in as well to make people think, oh yeah, that's true, right? There is a link to that. There is that important link. And if you look again at the YouTube, there is a really great talk. It's a short talk that I gave at a conference in the USA on that, the link of mental health and Imam al-Mahdi. So really an interesting way of looking at things like that. So check that out, inshallah, as well.
SubhanAllah, that's in your YouTube channel?
Yeah. Let me just quickly bring up the title of it. It's on my YouTube, but it's also on their websites. So it's called Mental Health and its Connection to Imam al-Mahdi. So if you just YouTube that, you'll find that talk. It's a short talk, but it's a really good one in terms of some of the stuff we've already talked about today, but the linkage to the Imam of our time and how to prepare ourselves as well, inshallah.
We'll definitely check it out. Well, to conclude, once again, thank you so much for joining us today. Again, lots of learning. I know that me personally, and I'm pretty sure all the audience will take this week to reflect. For the audience, for the participants, thank you so much for participating, your questions and being interactive. It just makes it more fun and makes it more interactive. So we really do appreciate it. I do want to let you know, this is a 3-part series. So we've done 1, and there's 2 the following 2 Mondays. So make sure to tune in the next 2 Mondays as well. And again, the questions are open. The link to the questions are open. So if you have questions and when you have time to reflect, if you have more questions, just submit it through the Google form link. And like Sister mentioned, please do follow her social media, Muslim Counselors. There's some really great content all over social media. So please do check that out. But other than that, that's it for me. I just wanted to end with Dua Imam Zamana. So if you all want to, I can't hear you guys, but if you all want to join and recite with me, you're more than welcome to. Bismillah ar-Rahman ar-Rahim. Allahumma kulli waliyaka al-Hujjat ibn Hassan. صلواتك عليه وعلى آبائه في هذه الساعة وفي كل ساعة وليا وحافظا وقائدا وناصرا وذليلا وعينا حتى تسكنه أرضك طوى وتمته فيها طويلا برحمتك يا أرحم الراحمين.
Allahumma salli ala Muhammad.
Muhammad.
Bless you, sister. Thank you. Bring your notebooks next time.
Oh, I have notes right here.
Next session is going to have lots of fascinating concepts that we've come across, but not that we haven't thought about from this perspective, inshallah. Ajjal Allahu ta'ala farajahu sharif. I had to make sure I got it right.
Okay.
Thank you so much, Sister Yasmin. I kept thinking about what you were saying. Jazakumullah khair. Thank you so much. I'm really happy to see our communities putting these programs together and look forward to the next one. And if anybody has any questions, don't hesitate to reach out. Like I said, I wouldn't be able to do the therapy with you, but I'd be more than happy to refer you to different resources, inshallah.
Thank you so much. Khuda Hafiz, everyone.